YouTube, it's Jessica again, here to give you another update on what's going on with my wrist. I know it's been a long time again since I posted my last update. I'm apparently really bad at keeping up with this. So we are in the middle of a pandemic right now, so I hope everyone out there is being safe, taking all the precautions they need to against COVID-19. I've pretty much just been sticking around home with my husband, self-isolating as much as possible, trying to do our part to keep the world safe and keep ourselves safe. So yeah, I hope everyone's staying healthy and staying safe out there. So when I last posted a video, we were talking about how I had seen the surgeon. That was both a good appointment, but it also caused a lot of pain due to him, moving my wrist around all in crazy ways. And I had left off, I was going to tell you guys about some ridiculously frustrating things I had experienced trying to get an MRI in BC. And I'll still talk about that a little bit, but I'll first say that the surgeon, the fellowship doctor that I met with, after he met with me, he had a conference with the attending surgeon who will actually be deciding what surgery is appropriate for me. And so the supervising attending surgeon decided that a CT scan would actually be more appropriate in my case, more so than an MRI. So I won't actually be getting an MRI anymore, but just to give you an idea of what I was going through, I had been told that an MRI would take maybe 6 weeks to book, and this, keep in mind, was before the virus outbreak, so things hadn't shut down yet. And in British Columbia, the way that MRI bookings work is your doctor, your surgeon, whoever is ordering the MRI, sends in a requisition directly to a central intake in the province. And the central intake receives all of these requisitions and then kind of divvies them up to all of the MRI clinics in the province, depending on, where you're living. Obviously, if you're in Lower Mainland Vancouver, they're not going to send you to an MRI clinic in like Kamloops or Kelowna. So they'll send you somewhere appropriate for wherever you're living, but they'll also try to divide by caseload so that no one MRI clinic is getting, overloaded with patients, causing longer wait times when there might be another MRI clinic that has, fewer patients and can take some of those. So central intake deals with that. It's a way to try to make sure people are distributed as fairly as possible. So after a couple weeks, I hadn't heard anything about an appointment from central intake or whatever MRI clinic I would be referred to. So I called central intake, hey, I saw a surgeon on so-and-so date and I'm waiting to hear what MRI clinic I've been referred to. And she took my name and my health number and looked me up in the system and said, oh, we haven't received any requisition for you. We haven't referred you anywhere because we weren't given anything. So that was frustrating to hear. I got off the phone with the receptionist at intake and called the receptionist for my surgeon. And I told her, Dr. Getz, or rather his fellow, I can't actually remember the name of the fellowship doctor. He, was going to order an MRI. I watched him fill out the requisition and click submit, but somehow it didn't go through. Central intake hasn't received anything. So she was profusely apologetic, said she would speak to the doctor, but that he was in OR all week, so she wasn't going to see him till the following week and get him to resubmit it. She explained that unfortunately she couldn't, it wasn't like a paper form that she had, it was an online thing the doctor had filled out. So she couldn't just like get it and scan it and send it back in again. She needed him to do it again. So about a week and a half later, we got back in touch. I don't remember at this point if she called me or if I called her back, but I told her that I had, again, called the CT place, the MRI intake, and nothing. I wasn't on the list. And she apologized again. She said she had spoken to the doctor. She'd asked him to resubmit it, and she had no idea why he either hadn't done it or, if there's a glitch or something, why it hadn't gone through. So she said again, I will speak to the doctor as soon as I see him. If I have to, I'll fill out a paper form and get him to sign it and send it in myself. And it was frustrating, but she was doing what she could to help. She was very friendly, very helpful. So I was trying my best not to get angry with her or upset or impatient. So again, a week or two went by, called the central intake one more time, still nothing. So I called her again, and still trying to be as patient as possible. I was like, okay, this is the third time I've called to try to get this dealt with. Central intake still hasn't received anything for me. Do you have any idea what's going on with that, or like, is there anything I need to do to get this going? And this time we had a resolution. She said she had spoken to the doctor, and that the senior doctor had decided to switch me to a CT scan, which uses a whole different referral system, so no longer dealing with central intake. But yeah, I thought even though I'm not getting an MRI anymore, I would share that just so people in BC especially know, like, if you're waiting for an MRI and it's been a few weeks and you haven't heard anything, do keep on top of it, do follow up, because sometimes, technology glitches happen, people make mistakes, things fall through the crack. So do keep on top of things and make sure that whatever scans you need, they're getting done. So I learned I was going to be switched to a CT scan, and I wasn't really given an explanation, and I am neither a nurse nor a doctor or a medical professional of any sort. But my basic understanding from the bit of research I was able to do is that originally they were going to give me a contrast MRI, and that would be able to show particularly well the blood flow going to the wrist. But my last x-ray, when I saw the surgeon in June, showed that the bone had already cracked in half, like was in 2 different pieces. And my understanding from my research is that if that's happening, the bone is obviously already dead. Blood flow is no longer the issue. So now what I think I found from my, Googling was that a CT scan would be better, more appropriate for imaging the bone itself rather than the blood flow. But I know in the last video, I'm going to tell you about some of the issues I had, some of the anxiety I had about the upcoming MRI, because it was a contrast MRI. And again, I know there will be people out there with Kienbock's who will need an MRI, will need a contrast MRI, and might have the same fears as me, might be deathly afraid of needles and not be certain that they're going to be able to do that very easily. So I do want to just go over briefly kind of the solutions me and my doctor came up with. It was actually my sister, who is a nurse, who had suggested that I bring this up with my doctor. She suggested I ask her about Ativan and something called EMLA cream. So I made an appointment with my doctor, explained, the surgeon wants a contrast MRI. I am horribly afraid of needles. I have panic attacks, I cry, I hyperventilate, I pass out. If I have an IV in my arm, I'm not going to be able to stay still inside an MRI machine. And so I told her, my sister nurse recommended Ativan and EMLA cream, and she agreed. She's like, yep, that's a really good solution for if you're going to be too anxious or upset at the scan. So she prescribed Ativan and EMLA cream, which the cream you put on whatever area of your arm. Some places will put the IV in down near the wrist, some will put them up near the elbow. I was told I should ask the nursing staff when they called to make my appointment where they typically put the IV in. So wherever the IV is going to go in, you put the cream on. About, I believe it was an hour before the needle. It might have been half an hour. I would have to double check that. But you put it on, and after 30 minutes, an hour, whatever it is, it freezes the skin so you don't feel anything. And then the Ativan, of course, I'm sure most of you are familiar with, is just a kind of general mild sedative that'll keep you calm. So my doctor's recommendation was that I would want to know if this was going to work for me before going into the MRI. So she gave me enough Ativan, 4 pills, so that I could do a test run at home and then still have medication left over for the actual MRI. So what she recommended I do was take 1 dose of the Ativan, 2 pills, see if I was feeling, relaxed, calm, good. And if that worked, then I should be good for the MRI. And do this, obviously, when you're at home, not needing to go out, not needing to drive, that sort of thing, not needing to go to work. So on a Friday evening, we set aside some time, my husband and I, and we decided to do a full run through. So my husband is diabetic, so we have lots of needles around the house, for injecting insulin. So we decided to give me the Ativan, put the Emla cream on my arm, somewhere around here. And then we decided we would get one of his, not the full injection, but just the little needle tip. And get one of those and just poke me with it lightly, see if I reacted. And if I didn't react, we would know I'm okay. And so that was kind of amusing. And yeah, it worked well. He sat there and he poked me once or twice with the needle. I had no reaction, didn't have a care in the world. So if you have any anxieties, I would definitely recommend talking to your doctor about solutions like that. Because had I had to have gone through with the contrast MRI, that it would have been a good solution for me. But as I said, that's not the case. I'm going to be going for a CT scan. I was going to be going on the middle of April. I had an appointment at St. Paul's Hospital in downtown Vancouver. But of course, we're in a pandemic. So I got a call from the hospital that they're not doing elective surgeries in BC. They're also not doing non-urgent, critical scans, MRI scans, CT scans, all that sort of thing. So they had to cancel my appointment, which was, I understand. I know we're in a pandemic and we need to do everything we can to keep safe, but it was still upsetting because it was like, oh, I'm just in so much pain. I just want to get this done with. But that's life. You deal with it. So I did find out recently that they're starting to reopen elective surgeries in BC, elective scanning, that sort of thing. So the CT scan is set again. I'm going to be going this Saturday. And it's, as I said, from my understanding, blood flow is no longer a concern the surgeons have for me, so it's not going to be a contrast MRI. So the Ativan experiment was kind of a moot point, but oh well. Aside from the frustrations waiting for the scan, the pain level I'm dealing with has been getting a lot worse, and the pain has been increasing kind of quicker and quicker, like before where it might, I might have one level of pain for a year and then notice oh, this is getting worse, and then a year. Now it's month by month I am noticing it hurts, and it's interfering with my quality of life a lot more. I mean, no one wants pain to interfere with anything in their life, but it's getting more and more noticeable, interfering with more and more things I like to do, which is a downer. I'm having to come to terms with a lot of things I can't do anymore that I really wish I could. At first, after talking with my doctor, I was taking kind of over-the-counter NSAIDs, non-steroidal anti-inflammatory drugs for anyone who isn't familiar with the term. And at first I was taking Advil, extra strength, and I was only needing it once or twice a week. If I'd have a particularly bad day, I'd take Advil once a day and it was fine. But I got to the point where, like, whatever the dosage instructions on the bottle were, take it every 4 hours, I think is what the dosage was. The pain got to the point that I was having to take an Advil, like, right when I woke up, take it, 4 hours later, take another one, 4 hours later, take another one, like, all day, just having to take so much Advil. And that was, at first, keeping the pain, again, manageable. But, like, I mean, you understand quickly that having to take Advil every day, multiple times a day, is not a good long-term solution. Not great. And then it got to the point where even that wasn't enough. I was taking all this Advil and it was still, my wrist was killing me. So I made an appointment with my doctor. It was at that point, we were in the pandemic lockdown, so it was an over-the-phone conversation. And it was really good. She asked me what sort of activities irritate my wrist, and that would be almost anything I do with it. It used to just be that kind of strenuous things bothered my wrist. If I was exercising a lot, if I was doing heavy lifting, lots of bending. But now it's getting to, like, brushing my hair with my right hand causes it pain. Hand sewing, like, you wouldn't think that just pushing a needle through fabric would be all that much strain, but that hurts. I can't chop vegetables with my right hand anymore because it's too painful. So lighter and lighter activities, gardening is, I use my left hand. I can't do anything with my right hand in the garden anymore. So I explained to her, like, all sorts of these things that are not onerous. They're not hugely strenuous tasks. And she asked what I had been using so far. I told her about the Advil. And she asked if I was having any stomach problems. And it hadn't occurred to me that taking Advil long-term, lots of it, can cause stomach issues. And at first I said, no, I don't think so, because I was thinking, stomach aches. And she said, well, what about heartburn? I was like, oh, yes, for the last 2 weeks or so, every single night when I go to bed, I get awful heartburn. And I hadn't made the connection that this is because I'm downing so much Advil every day. So she said, yeah, that's common when you're taking that much Advil. And we started talking about other options for pain management. She said, you can continue on as you're doing, but I don't recommend it. It's not working anymore for one thing, but it's also obviously hurting your stomach. On the other extreme of things, she said she could prescribe some heavier medication, getting into, like, opioid type range of medications. And that for her, and for me as well, was kind of like the course of last resort, because obviously they're addictive. You don't want to get on them if they're not absolutely necessary. So instead, we chose a middle-of-the-road path. So she prescribed me these pills. It's basically naproxen, so another NSAID, which can also damage your stomach. But this one is a pill that's combined with something called, and I'm sure I'm going to butcher how this is pronounced, esomeprazole, which is something that coats the lining of the stomach, protects it. So open up, let's see if you can, these are the pills, naproxen, esomeprazole, whatever. And I take these twice a day. I take one in the morning, one in the evening, 12 hours apart. You do have to take them on an empty stomach, so I take it in the morning as soon as I get up. Obviously I haven't eaten all night, and then I wait an hour before having breakfast. in the evening, I eat dinner. We usually eat dinner around 5 or 6. We pretty early dinner eaters around here. And then sometimes I'll have a snack, but usually I'm good after dinner. So I'll wait 2 hours after that meal and take the pill, and then wait another hour, and then if I'm hungry in the evening, I'll have a snack. Um, and that has been working really well. I've been in, I mean, if I do some of the things I've mentioned which hurt my wrist, then yeah, that still hurts me. But it's at least helping me, like I'm not just having a baseline pain where I wake up in the morning having done nothing and I'm like, oh great, my wrist is already killing me. So I've been really happy with this medication. I have no more heartburn, so that's good. And I'm, now that I've got the combined pill that protects my stomach, I can rest assured I'm not going to like burn an ulcer into my stomach lining with all these pain meds I'm taking. But yeah, so that's where I'm at. I've got a pain management that I can live with for now. These do, for the most part, work. I do still have occasional pain in the wrist, sometimes quite intense. And so on days like that, in addition to, the twice a day Ds that I'm taking, I can take Tylenol as needed. It is a different class of painkiller that naproxen and Advil are the same type of drug. NSAIDs, Tylenol is different. So they're okay to combine, according to the doctor and pharmacist I spoke to. So that's how I'm managing the pain so far. I think I'll end it there because this is getting quite long. I hope everyone, again, I hope you're all staying safe. Hope you're getting to spend lots of time with your family or your pets or whoever you live with, or hope you're at least able to, online, social media, connect with people that way. So yeah, stay safe, and I will have an update at some point after I get my CT scan and see the surgery. So thanks. Take care.